Welcome everyone to this Fitness Center Lunch and Learn. It's Diabetes Jeopardy with Susan Pearson. Susan graduated with her bachelor's in nursing in 1990 from the University of Michigan. She has experience in areas including critical care, adult education, home IV infusion, intermediate care, and most recently, diabetes care. Sue is a certified diabetic educator for Ascension Borgess Diabetes and Endocrine Center, where she teaches patients with diabetes on ways to enhance their quality of life. The goal is to prevent and or minimize the long-term complications associated with diabetes using lifestyle modification along with medication. She is married with two grown daughters, and she is helping us a lot with this presentation on Diabetes Jeopardy. Thank you, Susan, for being with us.
Oh, thank you. It's my pleasure. So I guess we'll go ahead and get started then. Um, Today's topic is we're calling it a diabetes challenge, and the way we're going to work it is the next screen, for example, will have a question. Let me see if I can click over to that, the next slide. I have a question, and then if anybody wants to chime in with what they think the answer is or has an idea about the answer, great. I'll wait, 10, 15 seconds for someone to chime in, and then we'll go to the answer slide where I have a longer explanation of what the answer is. So there's no pressure. I don't want people to feel like, oh, I got to answer, but it's more fun if you do. So anyway, insulin works to lower blood sugar by doing what to the cells? Anybody have any ideas? Well, insulin acts as a key that opens the gateway to allow glucose to get into the cells. Um, so, in other words, there are pathways in the cell that, in order for those pathways to open up and allow glucose in, there's a chemical reaction that has to occur. So, until that chemical reaction occurs with insulin, which is the key to that reaction, sugar can't get into the cells and it stays out in the bloodstream, where when it becomes high, it acts like shard glass in the bloodstream. So it leads to things like heart disease and kidney disease, retinopathy, which is like bleeding in the back of the eyes, and neuropathy, which is pain and tingling in the feet and legs to start with. So that is the answer to that. Anybody have any questions? And there is a chat forum, so feel free to chime in if you have any questions along the way, and I will keep my eyes on that if anyone has questions. Otherwise, we'll move on to the next slide. Okay, can you describe what a CGM or continuous glucose monitor does? You may have heard of the Libre or the Dexcom as two examples. There's several different kinds out there, but any idea what those do? So, a continuous glucose monitor monitors sugar in the fatty tissue. It's not actually a blood sugar. It's also referred to as the interstitial fluid. Um, and the way it works is that every 5 minutes it checks an interstitial tissue sugar. The tissue sugars are displayed in a graph form that you can see trends. So, for example, if your blood sugar is going high or low over a period of time, a little tiny filament that's in the tissue will measure this, and it talks to a transmitter, and the transmitter is Bluetooth to a receiver, which could be an insulin pump or your phone, for example, and allows patients to see what their sugars are and make treatment decisions, such as, is it low, should I eat a snack, or is my sugar high, should I give insulin, and that kind of thing. That's the down and dirty of a CGM. Okay. So this is a very common pill for diabetes that does not cause weight gain or low blood sugars, but it helps with insulin resistance. So this one, a lot of people, it's kind of the first line um, drug that most physicians will put people on when they have diabetes. Does anybody have ideas about what that might be?
Metformin.
That's right. Got it. Also known as glucophage. So it's the most common first-line treatment for type 2 diabetes after diet and exercise modifications have been attempted. It does not cause weight gain. It helps to lower the blood sugar by making it easier for sugar to get into the cells. So in other words, it decreases insulin resistance. So insulin resistance is how difficult it is to get sugar into the cells. So the insulin, when you have insulin resistance, has to work a lot harder, or the pancreas has to make a lot more insulin to get that chemical reaction to occur to open up the pathway into the cells and let sugar get into the cell. And metformin makes it less resistant, so makes it so it's easier for insulin to work and get sugar into the cells, thus lowering your blood sugar. Okay. So what is the medication advertised on TV that starts with an O and it has a catchy tune with it? I will not sing it because I can't sing. But anyway, it helps to lower A1C and protects the heart. Anybody have any ideas?
I can't hear the tune, but I can remember the name.
Oh, that's okay. It's Ozempic, or the generic name is semaglutide. And like I said, I would hum it, but I can't. It's going to sound different in my head than it does out loud, and it's not going to sound pretty. So anyway, this is Ozempic is a GLP-1, which is called a glucagon-like peptide. It's a medication that is advertised frequently on TV. It does a number of things to help your body work to decrease blood sugars. It's a hormone that your body already makes in the gut, but sometimes needs to be supplemented by the medication. There's other ones out there. Maybe you've heard of Trulicity or Bydureon or Victoza, or most recently on TV, Rybelsus. And they work to slow absorption of food in your gut, which helps slow down release of sugar into your bloodstream. They help also help the pancreas to release more insulin and less glucagon. So the pancreas makes two hormones. One of them is insulin, which lowers your blood sugar. The other one is glucagon, which raises your blood sugar. So we'll talk more about that later. But the liver will release less sugar into the blood when the GLP-1 hormone increases. It also helps muscle cells become less resistant. It triggers the brain to let you know that you feel full sooner, so you don't eat as much, and makes it easier for people to lose weight. And then it also makes the fat cells less resistant to insulin, so it gets easier to lose, like I said, to lose weight, having to do with both the fat cells becoming less insulin resistant and the brain, you know, feeling fuller longer or earlier. So it's kind of a wonder drug. It protects your heart. It does a lot of great things. So, and has the main side effects are like stomach upset. Some people, it takes a little bit to get used to that side effect. You become used to it, and then it goes away after time for most people, and they can tolerate it. So there you go. So when the pancreas, this is moving on to the glucagon subject a little bit, when the pancreas releases glucagon into the bloodstream, why is it doing this? Anybody have any idea? So glucagon works the opposite of insulin. It works to raise your blood sugar. So when the pancreas releases glucagon, it's telling the liver to release more blood sugar into the system. So it's helpful if your blood sugar is low for this to happen. So if symptoms of a low blood sugar would be like shakiness, dizziness, extreme hunger, irritability, vision changes, for example. And when you have diabetes, you may or may not have those symptoms, but you want to have glucagon in your system to be released so that the liver spits out extra sugar and raises your blood sugar. Okay. Now we're going to move on to meal planning and nutrition a little bit. Anybody have any questions on the first set of topics, which were disease process and medications? I'm not missing anybody here. So this is the type of food that affects blood sugar the fastest. So think about the different food groups or the types of food, not food groups per se, but it makes your sugar go up the fastest. There's proteins, fats, and carbohydrates. Which of those three would make your sugar go up the fastest?
Carbohydrates.
That's right. Carbohydrates. Okay. So when your blood sugar is low, these are the first line foods to eat to bring your blood sugar up. For example, orange juice, glucose tablets, honey, and milk. Fats and proteins will also raise your blood sugar, but they're broken down much more slowly than carbohydrates. So the raise in the blood sugar is much more slow as well, and your body is able to keep up in terms of insulin release to help keep your sugars a little bit more in control. But carbohydrates just hit you like a freight train. They raise your sugar right away and make it harder for your body to deal with the sugars being poured in. Okay, so I'm assuming that some of you have diabetes and that you'll probably know the answer to this, but if you're experiencing blood sugar less than 70, which is considered a true low, how many glucose tablets are recommended for most people with diabetes to take in that instance? You have a low blood sugar, and maybe you've been told by your physician how many blood sugar tablets you should take. Low. The answer is 4, or the equivalent of 15 grams of carbohydrates. Okay. The rule of 15 is something we'll cover a little bit more later, but it's basically, we call it the rule of 15 is because if you're feeling low, like you're shaky, sweaty, dizzy, anything like that that indicates you might be low, you want to check your blood sugar with a finger poke. If you have a continuous glucose monitor, you still want to check your finger with a finger poke because the blood sugar changes faster than the interstitial fluid does, which is what's measured, in the fat tissue. So you want to always check with the blood sugar with the finger poke. Measures the blood first. And then if it's below 70, you want to take 15 grams of carbohydrate, which would be like half a cup of orange juice or 4 glucose tablets, tablespoon of honey, a cup of milk. Those are examples each of 15 grams of carbs. Wait 15 minutes for the sugar to come up. Recheck the blood sugar. If it's still below 70 after 15 minutes, then repeat with 15 grams of carbs and recheck in 15 minutes. At that point, it should be up above 70, and then you can go ahead and have a meal or a snack that has protein and fat in it to help hold your sugar up. Okay? That's rule of 15. Okay, when you're thinking about meal planning and nutrition and you're looking at counting your carbohydrates, this carbohydrate source can be subtracted from the total carbohydrates in a food label as it is digested differently or more slowly. Any idea of what you can subtract? That's right. You got it. Fiber. Somebody chimed in and gave the answer. Okay, great. It's digested differently than other carbohydrates. It does not typically raise the blood sugar. So what we say is any amount, 5 grams or more of fiber on a food label, you can subtract that from the total carbohydrates. And when you're counting carbohydrates, you only look at the total and the number of fiber or the amount of fiber in the listing. You don't look at, excess sugars or that kind of thing. It's only the total carbohydrates minus the fiber if it's greater than 5. And of course, you want to consider what the serving size is. And we actually look at the serving size first and then figure out. So if you're going to have a cup and a half of something per serving, but you end up having 3 cups, remember to double the amount that you count in carbohydrates and subtract the double amount in fiber as well. Okay, this is for people who count carbs already and have any idea how many carbs are in a medium-sized banana. Too many, is what Martha said. Okay, well, it does have a lot of carbs, but you can have it. 15 grams of carbohydrates is what's in the size of a medium-sized banana, which is like a banana that's about 6 inches long. And bananas aren't good or bad. They have more carbohydrates than most vegetable or fruits, rather, if I'm talking in the right group. Good berries like strawberries, blueberries, raspberries, those have fewer carbs in them. So those might be better to stick to if you're trying to cut down on your carbohydrates. Okay, so this is more of the same. So if you had a turkey sandwich with 2 slices of bread, lettuce, tomato, and mayo, with a small apple for lunch, how many carbohydrates did you eat? So each slice of bread has approximately 15 grams of carbs in it, and a small apple has about 15 grams of carbs. Turkey doesn't have carbohydrates in it. Lettuce, tomato, mayo may have a little bit in it, but for the purposes of this, we're going to look at the bread and the apple. And so if you total those up, you should get about 45, I believe. Yep, 45 grams of carbs. Okay. For resources in terms of counting carbohydrates, a couple that are really helpful apps. One's called MyFitnessPal, and there's also an app and a book called Calorie King that if you're interested in, really narrowing down how many carbs are in fast food items, or you're trying to make a recipe from scratch and you want to know how many carbs are in what you put into the recipe, I believe MyFitnessPal will help you with that. There's also an app called Carb Manager. It's called Carb Manager that you can put recipes in, and it will figure out the amount of carbs in the recipe. Okay. Okay, so we already did this. This is another question about the rule of 15. Describe rule 15 for when you have a low blood sugar below 70. So again, remember it's checking your blood sugar with a finger poke. If it's below 70, eat 15 grams of rapid-acting carbs. Wait 15 minutes, recheck the blood sugar. If it's still below 70, then repeat the 15 grams of carbs and wait 15 minutes. And then have a meal or snack with protein and fat once it's above 70. Okay, so name 3 possible symptoms of low blood sugar. Anybody have any ideas?
Sweats,
Yep.
disoriented,
Yep. Sweats, disorientation, good. Shaking, passing out, yep. I see those on there. Good. So, blurred vision, weakness, agitation, yep, those are all things. So, dizziness, shaking, sweating, fast heartbeat, anxiety, hunger, blurred vision, fatigue, headache, irritability are the most common. Severe low blood sugar can include symptoms such as combativeness, seizures, unresponsiveness, or even death. So it can be a really horrible thing to have happen if if you don't get help right away. And again, once you get to or severe, you get unresponsive or are having seizures, obviously you wouldn't be able to eat or drink something. So we'll talk here in a second about what you use to treat it when your sugar when it gets that low. So here we go. What can be given for a very low blood sugar when a person is unable to safely eat or drink? Think about the hormone we talked about in the beginning of the presentation that your pancreas makes, but it makes two of them. It makes insulin and makes another one. That's right, glucagon. Okay, so glucagon is a hormone medication that needs to be given as soon as possible if someone's unable to safely eat or drink carbohydrates. There are several forms of glucagon. There's an intramuscular one that must be mixed, drawn up, and injected in the upper outer thigh. That's the old-fashioned one. But now we have some that there's nasal ones where it's a powder that you literally stick. It's like taking an inhaler, only it's in your nose, like taking Flonase, for example, that someone else would put up your nose and click it twice to give you, release the powder glucagon into your nose. There's also an injection that it's like an EpiPen. It looks so nothing has to be mixed. It just, you peel off a cap and inject it anywhere. So it could go in the fat or the muscle. Doesn't matter. That's called Gvoke. You'll just have to kind of see what kind of glucagon is paid for by your insurance. And this would be for somebody who is insulin dependent, people who are on metformin or other medications, oral medications, probably won't get so low that they would need glucagon. It's people with insulin that we are concerned about, and that we recommend that all our patients on insulin have a glucagon kit. Okay, so now we're going into the high range. If you wear an insulin pump and you have two unexplained blood sugars over 250 in a row, what should you do? And we're assuming you've treated this with insulin in between the two blood sugars, and it's just not going down. If anything, it's going up. Does anybody, I don't know if anybody of our listeners wears a pump or not, but wait a second and see. You would know. Away. Oh, there we go. So the answer is that we would want them to take an injection of rapid-acting insulin, not through their pump. We would want them actually to give themselves a shot and change out. There's an infusion set that insulin goes through from the pump to the body. It goes into your fatty tissue that would need to be changed out. We would also want them to drink lots of water. That helps dilute the sugar in the blood so it goes down, or in effect is less. And if you have type 1 diabetes, we would also want you to check for ketones, type of acid that builds up in your body if your body isn't getting sugar into the cells for use. Okay. Name the acids that are released when the body breaks down fat and muscle for fuel. This occurs when there's not enough insulin to get sugar into the cells for energy. So I just gave that one away, but anybody remember what I just said as far as acid that breaks down, builds up in your body, rather?
Ketone.
Ketones, that's right. Okay. So they're acid byproducts that are released when the body breaks down fat and muscle for fuel. This is due to a lack of insulin. So a person with type 1 diabetes can enter diabetic ketoacidosis, or DKA, rather easily if they don't have insulin in their body. If they experience trauma, severe infection, for example, those can be reasons also that they go into DKA, not just insulin pump site failure. Some symptoms of DKA or diabetic ketoacidosis includes spilling moderate to large ketones in the urine, severe abdominal pain or nausea and vomiting. They may have a fruity odor to their breath where you think that they're drunk or something. Change in mental status. So this is considered a true emergency, and the patient should be taken to the emergency room for treatment. They're typically very dehydrated, need a lot of IV fluids, insulin, and then also electrolyte replacement. Is when their sugars get so high, they draw out electrolytes from the cells, and they need to be replaced, with IV like magnesium and potassium and things like that. Okay, now we're moving on to monitoring. Were there any questions about the highs and lows? So, moving on to monitoring, an A1C tells what your average blood sugar is for how long of a period of time.
3 months.
3 months.
That's right, 3 months. And the reason we say 3 months is because that's the lifespan of a typical red blood cell. It's about 3 months. And the sugar sticks to the red blood cells. It's like it has a memory, if you will. So when a new red blood cell is produced, the sugar starts to stick to it. And some really smart scientists came up with a formula to measure it. By the time it dies, how much sugar is on it equates to what your actual blood sugar would be on average over the last 3 months. So it's a really, really good indicator of how your blood sugars are doing versus just checking, say, 2 or 3 blood sugars a day only gives you that point in time what your blood sugar is. But when it's looking at this average over 3 months, you get a really much better picture of how your sugars are actually doing on average over time. So that makes sense. So what is the American Diabetes Association's target for an A1C for people with diabetes? Where do we like your A1C to be?
6 to 7.
Yes. Yep. We like people who don't have diabetes, we like them to be less than 5.5. Our pre-diabetes is considered 5 to 5.5, and less than 5 is actually people without diabetes. But if you have diabetes and get your A1C to 7 or less, 7 equates to a blood sugar of about 154 on average. And so anything less than that is really helpful. Okay, so what should your blood sugar be 2 hours after the first bite of a meal if you have diabetes? What is our goal? You know it's going to go high when you eat no matter what, but then after 2 hours it should be coming down to a certain level or below. So the answer is 180 milligrams per deciliter or less. So if you have diabetes, that's what our goal is. For people who don't have diabetes, the goal is to have your blood sugar be 140 or less 2 hours after the first bite of a meal. But for diabetes, it's a little bit higher than that. So for fasting blood sugars, when you first wake up in the morning and haven't eaten anything, we like the sugars to be between 100 and 130 before you eat. So if you have diabetes. For people without diabetes, the glucose we like is less than 106. Okay. Monofilament tests check what part of the body for neuropathy?
The feet.
That's right. Very good. So neuropathy is a common complication of diabetes. A monofilament test is one of the ways providers check for sensation. So it's just like a little wire, if you will, flimsy wire on a card that they have you close your eyes and Tell them when you're feeling them poke your toes, and so you tell them which toe you're, either they're poking, or they'll say, "Can you feel that?" And you'll say yes or no. Anyway, people with neuropathy can often experience numbness, tingling, or burning in the legs and feet. And so the best way to treat that is to get your blood sugars under control. That will often help ease the symptoms. But there are medications too, like Neurontin, or Lyrica, for example, that people will often take to help ease that pain until they get their blood sugars under control. Okay, here's one. We're driving home today. If you're about to eat lunch but your blood sugar is below 70, what should you do?
Something.
What's that?
Eat something.
Eat something. That's right. You should have a rapid carbohydrate. So fix the low first. Get that orange juice or those glucose tablets or something that's pure sugar, a cup of milk. First, fix the low first, and then have that fat or protein. Just because the fat and protein of a meal take longer to break down and will make your sugar rise, but it'll be over a longer period of time. Now we're going into the miscellaneous section of our discussion. Does anybody have any questions so far? Watching the side, so I will try to keep looking over there. So if anybody has any questions, certainly feel free to put them in the chat section. Okay, so how often should you have a microalbumin test of your urine if you have diabetes? The answer is annually. And what this looks at is how your kidneys are functioning. It just gives a very basic screen of how your kidneys are doing. So one complication of diabetes is kidney disease. So if you think about, we talk about neuropathy in the feet, we talk about retinopathy in the eyes, and kidney disease. What those have in common is that they're all fed by very tiny capillaries. And when your sugar is high, it acts like shard glass in those tiny vessels. It kind of roughs them up and makes it so it's easier for them to, get clotted off or bleed, or for whatever reason the circulation that's in those tiny vessels doesn't work. It's not as good. Same thing with your heart and your brain if you're having strokes, things like that. So that's a huge reason to keep your blood sugars down if at all possible, so that you prevent those complications from occurring. So what is the number one complication of diabetes? Like what is the most common disease you see in people with diabetes?
Kidney issues.
Kidney issues? Nope. I saw neuropathy. Nope. Blindness? Nope.
Heart failure.
Heart failure. That's right. Heart disease. The most common complication, long-term complication, diabetes. And there are certainly risk factors that can be lessened to decrease the chances of developing heart disease. These include, obviously a healthy diet, managing your weight. Number one is do not smoke. Smoking is the highest risk factor for heart disease, whether you have diabetes or not. That's number one. If you can't get your sugar down, at least quit smoking. Controlling your blood pressure, controlling lipid levels, your cholesterol, triglycerides, and those kind of things, and controlling, obviously, your blood sugar levels. Somebody wrote death. Yes, death is the ultimate complication. How many different types of diabetes are there? And there's more than two. Anybody have any idea?
3.
3? No. It's actually 10, believe it or not. So, although type 1 and type 2 are the most common, there are 10 varieties of diabetes. So, there's a type, like with people who have cystic fibrosis, for example, they have a special type of diabetes. Um, People who have cancer of the pancreas develop a certain type of diabetes. Um, People who have side effects from other chemotherapy for different kind of cancers can develop diabetes. There's a whole slew of them that be brought out. There's latent autoimmune diabetes of adults. So that's people who are essentially type 1, meaning they don't make any insulin, but it develops later in life. Um, Type 1, we typically used to call that juvenile diabetes. Affects, people under the age of 25. Typically, if they develop diabetes and become insulin dependent, they're classified as type 1. Or if they produce antibodies that show that their pancreas is fighting off, or that their body's fighting off their pancreas, that's also a way to call them type 1. So.
Is that an autoimmune problem?
Autoimmune? Yes.
Yeah.
Yep. We don't know, like for type 1 patients, we don't know why the body sometimes will attack the pancreas or the beta cells of the pancreas, which make insulin. Um, Sometimes it's stimulated, they think, via virus, like chickenpox, for example. Some people can equate, my child had chickenpox, 3 months ago, and now they have type 1 diabetes, that maybe those could be linked. There's no hard and fast way to say, but that's what they think a lot of instances is it's related to some sort of virus that stimulates the body to attack itself, basically, or attack the beta cells in the pancreas. Name 3 vaccines that are important for people with diabetes to obtain. Well, one of them is really popular in the fall.
Flu?
Flu, that's correct. So we highly recommend that all of our patients who have diabetes get the flu vaccine. Because when you have diabetes, you are at much higher risk for developing bad outcomes from the flu. I mean, no guarantee that you won't get the flu, but it certainly decreases your chances of that happening. I see somebody wrote flu, shingles, and pneumonia. That's correct. Shingles vaccine for anybody over the age of 50. There's 2 vaccines. I think that you take one, and then within 6 months you're supposed to take the second vaccine of the shingles. Pneumonia, there's 2 kinds of pneumonia. There's the Prevnar 13 and the pneumococcal 23. So one of them is a one-time shot, and then the other one, I believe you have to get boosters every 5 years, and I'm not remembering offhand which one is which, but 2 kinds of pneumonia shot. Tdap would be like your tetanus, diphtheria, pertussis shot. Those are typically, unless you hurt yourself, 1 every 10 years is good. If you hurt yourself and it's been more than 5 years, then we recommend you repeat a tetanus shot. And then, of course, hepatitis B vaccine. That's a series of 3 shots. It usually takes over the course of about 6 months to get all 3 vaccines done. And of course, when the COVID vaccine comes out and it's been FDA approved, then it will be highly likely that people with diabetes, since they're high risk, will be recommended that they get that COVID vaccine. Okay, here's another miscellaneous. If you divide your dinner plate into 3 sections, one food group should fill half of the plate, and the other 2 food groups should fill a quarter each. What types of foods go where on the plate? Think about vegetables, fruits, proteins, or meats, um, that kind of thing.
Vegetable half with protein and fruit being the other two.
Yeah, that's very close. So the vegetables still half the plate, protein on a quarter, and then starchy foods are the other quarter. So like potatoes, rice, that kind of thing. But fruit can certainly be considered. You can have fruit in addition to the starchy foods if you want to, a little piece of fruit. But in general, vegetables half the plate, protein on a quarter, and then starchy foods like potatoes and rice, things like that. Good. Okay, obesity, this is the final question, and then we'll have time for discussion of if you have any questions or anything you want to discuss. Obesity is an epidemic in our country. Name 2 things a person can do to combat being overweight.
Be a nutritionist.
Yeah. Sure. Food and exercise. 0. Good. Well, yeah, definitely. So exercise, what the American Diabetes Association recommends in terms of exercise and amounts and types is that you should plan on trying to get a goal of 150 minutes of aerobic type exercise. So walking, 5 days a week, 30 minutes each day, and that can be broken up. You could walk for an hour, 2 days and a half an hour another day, for example, or do, aerobics or running or anything like that. But whatever aerobic exercise you do, they recommend 150 minutes. And then in addition, some sort of weight training or strengthening exercises for 30 minutes a week. Eating a healthy diet, so seeing a nutritionist is a great idea so you can tailor, how many carbs is it recommended for you to eat to either lose weight or maintain your weight, or gain weight. Some people need to gain weight. Getting good sleep, this is something we assess on our patients frequently, is have they had a sleep study? We ask questions like, does your wife say you snore, your husband say you snore? And if they get a yes, then we usually order a sleep study. So a lot of our patients do wear CPAP or BiPAP at night, and it makes a huge difference in their blood sugars and their blood pressure. Good sleep is extremely important. Decreasing stress can help you lose weight. Just different hormones are released when your body's under a lot of stress that help you hang on to fat. So, going to those yoga classes or a vacation are a good idea. Keeping a food diary is a good idea so that if you can keep track of every bite of food you put in your mouth. Most people are amazed because we just blindly eat, a lot of us, not even realizing that we're eating, we're just doing it. And then when you actually look at it on paper, it's like, wow, I thought I was eating 1,200 calories, and here I'm eating 3,000 calories a day. And then there are many food or phone apps out there that are useful for losing weight as well. So, all right. So that's what I have for my presentation. But do you have some questions or comments or anything you were hoping we would discuss today that we didn't touch on? I wrote, you find a lot of hidden calories and carbs. Yes, you do.
I have a question. My father has dementia, and he's been a diabetic for years, and I've been reading a lot about it, and it says that sometimes when people get dementia or Alzheimer's, their body forgets that they have the diseases, and his blood sugar has been all over the place. Could that be a reason for that?
You've read that the body forgets that it has the diseases?
Yeah, when you have dementia or Alzheimer's, it's like your body forgets that because your brain's not signaling everything.
Oh, I suppose that makes sense. I haven't
Yeah,
heard
'cause his
anything about that.
yeah, his blood sugars have been like all over the place, high and then super, super low
Uh-huh.
continuously. And I was just trying to figure out what might be causing that.
Yeah. Boy, I that's a really good question. I can look into that. We haven't done any studying about that here, but it makes sense that, if your brain is having troubles in thinking and thought process and running your body otherwise, I can imagine that it would make sense that it might mess with your metabolic system as well, and mess your sugars up. Does he take insulin?
He does, and they've dropped, like, he had the rapid insulin and the longer acting one, and they've completely halved the long acting one and done away
Mhm.
with the rapid one completely.
Okay. And is that seeming to help so he's not having the lows like he was, or is he still really all over the place?
Most of the time it's helping, if we can keep
Good.
him not stressed.
Uh-huh. Yeah, like stress, that I think makes a huge difference. So, yeah, that's really interesting. I'll have to ask around a little bit or do some research on, the difference between if you have Alzheimer's or dementia, how that affects blood sugar. That's a good area to look into. So, well, I wish is it your father-in-law? Is that who you said?
It's my dad.
Your dad. I wish him all the best. Oh, and somebody wrote, logging your food helps to find how food affects your blood sugar. That is the truth. I have a lot of patients who swear by oatmeal. Well, oatmeal for some people will raise their blood sugar really, really high compared to regular cereals, and so for some people it just holds it steady. So that's one example of a food that is really important to log your blood sugar or log your food and check your blood sugar to see how it affects you. Yep, same thing with rice and wheat are other ones that affect people differently as sugars go. Okay, is there anything we talked about today that you want to talk more in depth about? We talked a little bit about medications and somebody wrote about dehydration affecting sugar. Yeah, dehydration makes a big difference in how your sugar, overall sugar, so you think about the blood being diluted with water, for example, that effectively lowers your blood sugar. So it is important to drink. We recommend 8 8-ounce glasses of water a day. Anyway, is there any questions about medications that we touched on, or um, more about insulin pumps or continuous glucose monitors or anything like that? So maybe what I will do is I will stay on this for another 10 minutes or so. So if people have individual questions, they can send chats. And otherwise we'll turn it over to Martha. And thank you so much for inviting me to help lead this discussion. And hopefully you found some things that were helpful for your own health.
Thank you very much, Sue.
You're
Um,
welcome.
I really, really appreciate you. It's always a pleasure to have you with us. I know you have done a couple other Lunch and Learns.
Oh, you're welcome.
Now, for all these, once you get diagnosed with diabetes, and you say the range is between, I think it's like what, 6.5? It's when you are considered diabetic, your A1C.
Yeah, anything above 6, I believe, is considered having diabetes. If you're between 5.5 to 5.8 or so, it's
Hmm.
considered pre-diabetes. So you're on your way, but you're not quite there. And then, I mean, depending on the physician, between 5.5 and 6 to 6.5 is where they diagnose diabetes officially.
I see.
Or they also do fasting blood sugars. So if your fasting blood sugar is 126 and they check it, maybe 3 months later and it's still over 126 and you're fasting when you have your blood work done, then the doctor will diagnose diabetes. Um, if it's above 100 or so, 100 and 126, then they'll call it pre-diabetes. So your pancreas hasn't officially, you
Give
know,
up.
given up, but it's on its way if you don't make some quick changes. And it may not have anything to do, if it's type 1, obviously it has nothing, you just, body's going, your pancreas is kind of kaput, and you have to have insulin. But there was something I was going to say about that, and I can't remember.
Now, the
Oh,
126 is not with your meter, is it?
well, it would,
The one.
yeah, you could use your meter, your blood sugar
Okay.
meter, if it was 126 and you were fasting. And when I
Hmm.
say fasting, you need to not have anything to eat or drink for 8 hours or more before you take it.
Okay. Perfect. Well, that's a lot of good information.
Oh, good.
There
What I
were
was
things
going to
that I didn't know.
Oh, yeah. Well, good. There's a lot to diabetes, that's for sure. There's a lot of different aspects, and we're always happy to have people come, and we have lots of information we can give, lots of materials, paper materials and uh, websites and things like that that we can recommend. And there's a lot of experts around that are happy to help when any questions or need some assistance, loved ones, and that kind of thing. I was going to say that when you are diagnosed with diabetes, it's estimated that 50% of your beta cells in your pancreas are not working if you're diagnosed with type 2 diabetes, let's put it that way. That by the time you're diagnosed, about half of your beta cells are not working any longer.
In your pancreas.
Mhm. Yeah, the beta cells in your pancreas, yep.
Is it a way to help your pancreas heal?
Basically, it's weight loss and eating healthy, uh, doing all those things, decreasing your stress,
Hmm.
exercising, those kind of things lower the insulin resistance or how hard your pancreas has to work to make insulin and to make it work on the cells. So anything you can do to make it easier for sugar to get into the cells, make it easier for insulin to open up those pathways to get sugar into the cells, anything you can do to help that makes it more likely that your pancreas can then um, keep up, if you will, or potentially heal. You can't. You can put diabetes into remission. Let me
Hmm.
say it that way. Um, there really is not a cure for diabetes. Once you've gone over that, um, the fasting of 126, or you have an A1C above 6 or so, you can certainly get your A1C down in the 4 or 5 range, and we call that being in remission. But once you're prone to having diabetes, then if you over time you will probably have to really struggle to work to get that A1C to get back where you want it to be. It's kind of a progressive disease.
And is it because of the pancreas?
I'm sorry?
Is it because of the pancreas?
Yes. Yep. We've seen dramatic results. We'll have patients come in and their A1C might be 12, and we'll, get them on a program where they're doing exercise and they're eating, low carb diets and maybe taking metformin. And within 3 months, they've dropped their A1C down to like 8 or 9, and then they keep doing what they're doing. And we might add a medication like Ozempic that we talked about a little bit before, and they'll come back 3 months later, and now they're down to 7 or less. So they can do a lot to help their diabetes. Once they put their mind to it and are able to follow some of the guidelines. It's not easy. It's a lot of work, but we have
Oh, it's
patients
a
that
change of
do.
lifestyle.
It is. It's they have to change their lifestyle. So if anybody has any questions that you want to email me about, I can give you my email. It's Susan.Pearson, Pearson, 2, the number 2, at Ascension, ASCENSION.org. So Susan.Pearson2 at Ascension.org. And I check my email several times throughout the day, so if you email me, I will get back to you. You can also try calling the office here at Ascension Borgess. It's 269-226-8321 and leaving me a message, and I will return your call.